Smile, damn it.
Rar.
Talking about your own mortality is humbling.
The more we talk, the more our trusted people and our friends and family will know what our wishes are.
What has changed is the urgency of the discussion.
We had two separate close friends. One was mine and one was his, pass away suddenly within a year's time. It was a good reality check to kind of realize that this could happen to anyone. By doing these plans and getting everything in order, so to speak, we don't have to worry about it now.
No one is really guaranteed to get home at the end of the day. And just because we think our loved ones or our most trusted people will understand or think what we know, they'll know what we want, they might not know if we haven't really told them. So it's important to have the conversations, not just about medical interventions, about whether you want CPR or ventilation or intubation or blood products or kidney dialysis. It's talking about the quality versus the quantity of life that's really important to someone. And so having those conversations early on really does bridge that gap. Because someone might say, I don't want tubes. But then that makes me think, is that an IV tube? Is that a catheter? Is that an oxygen tube? Being very clear, saying I don't want to be a vegetable. Well, a vegetative state means you're brain dead. But does that mean that you can't have a conversation with your family because you don't recognize who they are? Or does that mean you can't feed yourself? Or does that mean you can't go to the bathroom by yourself and dress yourself? Or just thinking about how you would want to be after a medical crisis. Do you want to go home? Would you be okay living in long-term care?
And if you have a plan in place, you're a lot better off. I know exactly what my partner wants done if a medical emergency were to occur, and the same with myself. So I think by taking those steps, it really allows a lot. It reduces stress and it brings a lot of calm in those stressful situations.
Prior to COVID, I would see people usually in one of two circumstances. Either one, they were leaving on a big trip and somebody had told them somewhere that they better get their estate planning in order. And so they would come in a bit of an emergency to do up some documents before they jumped on a plane. And then the other reason I'd see people is that they had been involved in somebody else's estate. Either a parent had died, a sibling had died, and they had seen what had happened when there wasn't good estate planning in place. And so then they decided they better get their act in order. So that's what I used to see. Now with COVID, I'm seeing a bit of a different approach. And I think it's a positive approach to estate planning, where it's really awakened in people the desire to get your affairs in order, regardless of your age and regardless of your circumstances. And so I'm seeing younger and younger people come to address their estate planning. And I'm seeing people come to me before there's an emergency.
I think the most awkward part of doing all of this planning was just getting the ball rolling. Talking about your own mortality is humbling. It's something that is going to happen to all of us, and it's not something that we like to address on a day-to-day basis. But by doing these plans and getting everything in order, so to speak, we don't have to worry about it now.